Hello, my name is Madhu Kihalagama and I'm an occupational therapy student in Oxford University. Thank you very much for joining me today. I'm making this video about osteoarthritis at the base of the thumb. What I will do is I will give a brief overview of the condition, and then I will go on to explain and demonstrate some interventions that occupational therapists provide for people with this condition. To better understand the condition, let's have a look at the anatomy of the hand. This is a picture showing bones in the hand. So what we're interested in is thumb, which is right here. And as you can see, it's made up of three bones: distal phalanx, proximal phalanx, and the metacarpal. This is metacarpal bone 1. And the joint we're interested in is the joint right here, which is made up of the metacarpal bone and one of the carpal bones, which is called trapezium. And this joint is known as carpometacarpal joint 1 to be specific, or CMC1. Now let's talk about how osteoarthritis at the base of the thumb occurs. When two bones are joined together to form a joint, there is a cartilage layer between the two bones, and this cartilage layer makes the movement of the joint more smooth, and also it prevents pain. When osteoarthritis occurs, what happens is this cartilage layer becomes thin, and over time it can cause the bones to grind against each other. And first of all, what happens is the patient gets a painful thumb, and over time what could happen is deformity. That means when two bones grind against each other, it could wear off, and that could lead to changes in shape, which will cause instability in this joint. Now let's talk about common risk factors and some common symptoms of this condition. Common risk factors for this condition are age, which is being over 40 years old, and female gender, having injury or operation in and around this joint previously, and also repetitive manual labor. Common symptoms of this condition are pain, which is an aching pain at the base of the thumb, swelling, which is common in osteoarthritis, stiffness, which usually occurs after a period of rest, and also it could lead to, at the latter stages of the condition, it could lead to deformity in the joint. Now let's talk about interventions that occupational therapists provide for individuals with CMC1 osteoarthritis. There are different kinds of interventions. First of all, let's talk about exercises. There are different types of exercises that one can do, and the aim of exercises is to improve the strength and also maintain range of movement. By doing these two, the idea is to maintain the level of function they have in their hand. So it is really important that they keep using this joint, because it is really easy to completely stop using this joint because of the pain. But by doing controlled exercises, they can maintain the range of movement, and they can keep the strength, because if you stop using a certain set of muscles, then they tend to become weak, and also the joint can become really stiff. So exercises can be really helpful, and there's evidence to suggest that it helps with those tasks. Exercises help with those tasks. Before doing exercises, there are a few things that someone should consider. These are for kind of like making sure that they are safe in doing these exercises. First of all, this is pain. One can think that they should be working against the pain, but actually what should happen is they should work with the pain. So that means that if they are asked to move their finger to a certain range, they should only do it as much as the pain allows them to do. If they're doing against the pain, then that could be detrimental. That won't be beneficial for them. And the other one is number of repetitions. And a clinician might recommend a certain number of repetitions, but it is, if one finds that it's difficult for them to manage the repetition, then they can always do less number of, or always reduce the number. And the other one is to make sure that they do this exercise correctly. And if it is done wrong, then that could lead to other problems, which is not great. And again, it is really important that they consult a clinician that has an understanding about these exercises and also other interventions before getting into it. So the first set of exercises that I'm going to be demonstrating are about maintaining the range of movement, and these exercises one can aim to do twice daily. The first exercise is thumb flexion. So thumb flexion is this movement. So you have the thumb in this position and then you move it across your hand onto the other side. And what you do is you hold this position for 10 seconds and then release to this position. Hold it for 10 seconds and release. And you can do this 3 times. Two repetitions, and this is the same for all other exercises in the range of movement. So you hold it for 10 seconds and then release, and do that for 3 times. And the next exercise is thumb abduction, and by abduction it means moving the finger away from the hand towards this direction like that, and that motion. And the other one is thumb opposition, and opposition means moving the hand across the center of the hand, moving the thumb across the center of the hand to the bottom of the middle small finger, and doing it like that. The other exercise is a thumb extension, and by extension we mean this movement. So as I told before, these exercises hold for 10 seconds and do 3 repetitions of that. And the next one is strength exercises. So for strength exercises we can use some resistance, and we add the resistance. So I have this band with me, and this is a normal rubber band, but there are some therapy bands that can be purchased to add some resistance to this exercise. So before I demonstrated, these exercises are aimed to be done 2 or 3 times weekly. So these exercises are put bit more strain in the muscles and in the ligaments of the joint when doing it compared to the other exercises. And also it is recommended that there is a 48-hour gap between between 2 exercise sessions for that recovery of the muscles that you use during this activity. So it is it's very simple. So basically you put this thumb around the hand and make sure it goes over this web, goes over this web, and that is to make sure that the resistance is applied onto this the CMC1 joint. So what you basically have to do is to keep your hand like this and then move like that. And it is recommended that you do this 10 to 15 repetitions, 10 to 15 repetitions each, and doing it 2 or 3 times weekly. Now let's look at activity modification. So what happens during activity modifications is finding alternative ways to perform certain tasks in a way that it reduces the stress on this joint. And the aim of this modification is to reduce pain, reduce inflammation, and help with reducing fatigue, and also increase physical fitness. So although there isn't a strong evidence base like compared to exercises, these modifications can be recommended by a clinician on an individual basis, and for that the clinician would have to have a good idea about what sort of tasks or what sort of occupations does this patient perform, and then they would have to cater those modifications according to that. And so few small modifications that I can show to you is the first one I can show you is the holding a book, which is usually I would hold a book like this if I'm carrying this somewhere else, but as a modification what you can do is to carry a book like this. So in this way you're spreading the whole weight of the book, throughout all the joints of the hand. So one joint is not getting all the strain. And that's a simple one. And again, another one for carrying something like this is hugging the object. So rather than just having it on your hand, just hug it, and again that reduces the strain on the thumb. And another one would be to when you're holding a cup, which is a very common thing for everyone to do. So rather than usually people would tend to hold like this, and again you can see how that puts strain on this joint. And what we can do is to hold the cup like this with more fingers as much as possible, and then alleviate the weight with the other hand, and so that's not putting weight on onto the thumb. And another simple modification is about moving things along a table. So if there's like say you have a kettle that's full of water that you want to move from one place to the other, rather than lifting it and bringing it over, you can simply slide it on the surface and get to where you wanted to get it. And another thing to remember is that always if you are struggling with performing certain tasks, don't overdo it. Don't try to work through the pain. Just ask for some help, and make sure that that joint is protected. Make sure that you are not causing any more further pain onto that. Another type of intervention is splinting, and occupational therapists are experts in doing these splints. And So thank you very much for watching this video, and I hope you found it useful. Please make sure to leave a comment with some suggestions and also what you thought about this video. And thank you very much again. See you next time.